歡迎大家。
Welcome to the press briefing. We have Dr. Chuang Shuk Kwan, Head Communicable Disease Branch Center for Health Protection, and Dr. Gladys Chan, Chief Manager, Hospital Authority. They will be updating you on the hospital authority and also the latest number of cases. First, Dr. Kwan. There are now 1,390 patients at the hospital. 162 are newly admitted patients. Among patients who are in isolation, 429 are in isolation wards, 25 are in second-tier isolation wards. 429 patients are in the North Atlanta Hospital Hong Kong Infection Control Center. Altogether, 121 are new patients. Yesterday, we reported 4 patients to be in critical condition, 7 in serious condition. Among patients hospitalized, 28 are in critical condition and 19 are in serious condition. For the 8 critical patients, they are under intensive care. And there are 10 newly reported death cases. 9 passed away yesterday, 7 male and 2 females aged between 74 and 97. We also received information from the Department of Health that a 76-year-old female patient was sent to the accident emergency ward on the 20th of July, and she passed away. And then eventually she was found to have contracted COVID-19. And for among the deceased patients, 4 came from residential care homes. They all had chronic diseases, but all of them did not complete the vaccination course. Some had only 1 or 2 jabs, and some had no vaccination at all. And for the 10 cases, I will briefly go through them. First one, a 79-year-old man. He had hypertension. He had stroke before. He also had dementia. Because of cardiac arrest and pulmonary edema, he was in hospital. He was sent to He was sent to the accident emergency ward, but then his condition deteriorated. He passed away yesterday. Then there's an 89-year-old female who had 1 dose of vaccine. She recovered from breast cancer. She had diabetes and hypertension. She also had to have oxygen treatment at home. She felt unwell. She went to the accident emergency ward. She tested positive, and then she had multiple organ failure, so she passed away yesterday. The third one, an 86-year-old male who lived with his family. He had 2 doses of vaccine. He had hypertension. He had also had cancer and dementia. And then he tested positive with RAT, and then he came to our clinic for treatment. And then he had shortness of breath. He went to the accident emergency ward, and X-ray showed that there were signs of inflammation on his lung, and then he started to receive treatment, but then his condition deteriorated. He passed away yesterday. The fourth patient, the fourth deceased, an 86-year-old male. He had diabetes and hypertension. He had an upper respiratory tract infection, so he sought treatment from the accident emergency ward, and then he had organ failure, and he passed away yesterday. The fifth one, an 85-year-old male, he did not have any vaccine. He also had the usual hypertension, diabetes, and so on. And then he passed out on the street on the 20th of July. And then when he was admitted, there were signs of upper respiratory tract infection. And then eventually he tested positive for COVID-19, and his condition deteriorated rapidly, and he passed away yesterday. The sixth patient, 84-year-old male who couldn't take care of himself. He also had signs of cardiac problems. He had stroke before. He had a fever and had shortness of breath, so he sought treatment from the A&E ward, and then eventually there was organ failure, and so he passed away yesterday. Seventh one, an 84-year-old male. Again, he had hypertension, diabetes, and so on, and then he had stroke before. He had a fever at the residential care home, so he sought treatment from the A&E ward, and then his lung condition deteriorated. He needed more oxygen, and then he passed away yesterday. The eighth patient, an 83-year-old male. he had bypass surgery, and then he had other chronic diseases. He had vomiting and shortness of breath before he came to the A&E. When he arrived at the A&E, his heart stopped beating and he could not be resuscitated. His case referred to the coroner. And the ninth one, the 74-year-old female, she had JEP, she had stroke before, she also had dementia, she had fever, vomiting and diarrhea, and she was sent to A&E. And then there was for complications with further inflammation, and she needed a high level of oxygen, and family members asked for just palliative treatment, and she passed away yesterday. Now there's another female 76-year-old who passed away on the 20th of July. She had no vaccine, she had no other chronic diseases, she only had glaucoma. And then she was found unconscious at home and with any symptoms before that. And when the ambulance arrived, if she did not have heartbeat, and then her case was and then she was sent to hospital, and then her case was referred to the coroner. In the past, 185 patients recovered. 168 of them have been discharged. And then 2 patients tested positive upon admission screening. 2 patients or staff members are listed as close contacts. 25,817 patients have recovered so far, and 25,817 staff members were confirmed cases. 25,249 of them have returned to work. And then there's a staff member who tested positive at the Kwai Chung Hospital on the 22nd of July. We conducted contact tracing with 2 other staff members and 1 patient who positive, and so we're trying to establish any links with these cases. The condition of the patients are stable. They've been sent to the Princess Margaret Hospital in the same ward. There are 4 other patients listed as close contact. The hospital arranged for all patients and employees in that ward to be tested. Now, I would like to appeal to those who test positive, especially the elderly, especially those with chronic diseases, their condition could deteriorate rather quickly. As you can see from the 10 death cases I mentioned just now, for the elderly, their condition could deteriorate really quickly when they started with mild symptoms. So if you test positive, you must report the case even if you have only mild symptoms. We would like you to seek treatment as soon as possible. And if the clinic condition is suitable, then we would prescribe COVID oral medication for you, so you could start treatment soon, and then that won't delay your recovery. I would like to take this opportunity to remind you again, there are various channels for you to seek treatment. Apart from the 7 designated clinics, for patients in home isolation, you could call the hotline of the Hospital Authority 1-836-115. And then our colleagues would also try to identify suitable patients through our HK Go app for teleconsultation. And after teleconsultation, the medicine will be dispensed to door to door. And then at our hospital, we also administer the COVID antiviral drugs. So as the epidemic is worsening, so you have to be alert. Even if your symptoms are very mild, you have to seek treatment. We will prescribe oral medication to suitable patients, because early administration of medication could prevent the deterioration of the condition, and also it could effectively reduce the viral load, and then you could test negative sooner and recover sooner. We are also considering whether we could relax the clinical guidelines further for the prescription of this medication, so more could be administered with the medication. And for those who have not been vaccinated, please do receive the jabs as soon as possible and reduce the chance of serious conditions. Thank you.
Dr. Chang, yesterday we had a total of 4,288 positive cases, including 1,763 positive PCR results and 2,525 verified RAT results. We had 220 imported cases, including 203 positive PCR cases and 17 positive RAT cases. And as Dr. Kwan suggested, we had 10 deaths today, and since the fifth wave started, we had a total of 9,265 fatalities. Among the 230 imported cases, there were 112 who tested positive at the airport, 87 tested positive at quarantine hotels, 21 tested positive after the patients left the quarantine hotels. The 230 imported cases came from 5 places, and these places had 10 or more imported cases, including 43 from UK, 20 from Thailand, 18 from the US, 17 from Nepal, and 13 from the Philippines. For the remaining 45 places, there were 10 or less cases. For residential care homes, 4 residential care homes saw new cases, including 3 residential care homes for the elderly and 1 for the disabled. 1 匯豐安老院環隨有限公司 located in Eastern District. 1 resident and 1 staff member tested positive. 2 residents and 1 staff member had to be quarantined. 翠福 elderly home in Sham Shui Po saw 1 resident and 1 staff member testing positive, and some of them had to be quarantined. Thang Tat elderly home in Shao Kei Wan. Yesterday, 1 resident and 1 staff member tested positive, and today 2 more residents tested positive, for a total of 3 residents and 1 staff member. All 30 residents from the first floor had to be evacuated and quarantined. Another residential care home for the disabled, the Caritas elderly home, 1 resident tested positive, 5 other residents had to be quarantined. For schools, today is Wednesday, 371 schools reported 482 positive cases, including 395 students and 87 teachers or members of staff. The 250 schools reported 2 or more cases over the past 7 days, and today some schools had to suspend classes for a week, including certain classes from the following 6 schools and 2 other schools due to other reasons. First, Lutheran Shalom Tong Kindergarten Chioi campus in Wong Tai Sin, the morning A5 class, the SKH Jubilee School class 5B, 23 of 22 students tested positive. Kun Tong Baptist Kindergarten K3B class, 2 of 11 students from that class tested positive. 寶血幼稚園 a morning class had 33 students and 3 tested positive. 天水圍 Methodist Secondary School class 4D, 5 of 43 students tested positive. The Christian Lutheran School in Shatin, in a Form 2 class, 3 of 30 students tested positive, and these classes had to be suspended for a week. For 2 other schools, we saw a possible transmission due to the school bus. 愛義會紀念學校 a school bus carried 4 students and some staff members. 1 of the students and 1 of the staff members tested positive. It was a special school, and passengers who use that school coach service had to stop going to school for a week. For 崇真紀念學校, for class number 19, 9 students and 2 staff members used that service, and 2 students, 1 worker, and 1 nanny were on board bus number 19, and the relevant classes had to be suspended for a week. For the subvariants for the suspected cases of BA.2.12.2.1, they make up 3.1% of the positive cases, while BA.4 and .5 made up about 1.9% of the total. There were slight increases. We now proceed to questions. Please identify your organization before you speak. The reporter on the back row, please. Good afternoon, this is Cable TV. In terms of its prescription of oral antivirals, can you tell us more about the relaxation of such prescription guidelines and which patients would receive these antivirals? Mr. Tam Yu-chung said there was a lack of quarantine hotels and inbound arrivals should be sent to makeshift hospitals, and the National Health Commission could deploy staff in Hong Kong. From a risk management perspective, is this possible, and is this something on the agenda of both governments? Regarding your second question, I have no information on hand, and if there are updates, they would be announced by the government. In terms of the relaxation of the prescription guidelines for oral antivirals, the matter is still under discussion. We will announce any updates. Any other questions? The gentleman on the back row, please. This is AM 730. According to a news release from the Department of Health, a man was sentenced due to a breach of the epidemic control regulations on May the 9th. Did it stem from the Peony Golden Cod restaurant? Was it the first conviction due to a breach of the compulsory testing notice? And yesterday it was mentioned in the press conference that individuals with slight symptoms should still seek medical attention. So for individuals or elderly persons without symptoms, would you advise them to visit designated clinics and be prescribed with the medicine? For the HA or Department of Health, can you provide figures on the number of antiviral drugs prescribed? I have no information on the person who breached the compulsory testing notice. The HA provides a medical support hotline for a person who tested positive. Even if he had no symptoms, he can still call the hotline. Through a conversation, we can find out whether the patient had additional medical needs. For patients above the age of 60 with chronic illnesses, we would assess whether the prescription of such drugs is appropriate, so they can call our hotline or consult our staff at this designated clinics. In terms of the doses of oral antivirals prescribed, as of July the 24th, we prescribed over 38,000 doses of COVID antiviral drugs, oral antivirals, including 21,000 molnupiravir doses and 17,000 doses of Paxlovid. 10,000 doses were prescribed to patients in A&E wards and in hospitals. 27,000 were prescribed to other suitable patients in private hospitals. As of the 21st of July, private medical practitioners prescribe two types of oral antivirals to 400 COVID-19 patients. Next question, please. The reporter on the back row.
How is the distribution rate of oral antivirals so far, while the hospital authority has asked elderly patients to seek medical help as soon as possible. Are there any ways can the HA reach vulnerable groups with prescription more proactively? Also, are there ways for elderly patients to know if they need prescription or not? Thank you.
Oh, thank you for your questions. As I just mentioned, we have different ways and we are proactively to reach out to our elderly patients. We have the hotlines which we identify those patients. If they are at high-risk group, we are proactively contact them and to see if there is any need. And also, they through different channels. For example, now we are promoting the designated clinic as well as the telehealth, so that from different channels, hope that all the elderly patient or even their family can reach us to us if they have any concern.
下一題，
Next, please. To the right, the last row, the one in black, please.
From Phil TV News, can you recap in English how are you going to loosen the regulation for oral drug for curing the COVID-19 patients? Thank you.
Sorry, can you repeat your question?
You said you're going to loosen the regulation
okay.
for oral drugs.
Okay, so we are still at the moment discussing within our expert group to see whether we can expand whether either lowering the age or whether there include more high-risk patients. So we are in the process of discussion. So if there's any update, we'll announce to all of you.
下一題，
Next, please. At the back, to the right, the one in the shirt. I'm from Now TV. About relaxing the clinical guidelines on oral medication. You say you're in discussion, but in which direction and what sort of age group are we talking about? And then there's an 88-year-old deceased. The patient went to designated clinic. So what was the condition of patient when the patient was at the clinic? And did you describe any oral medication? And then for Zhongshan school bus, 11 persons, 4 are confirmed, right? Do these children come from different classes? So is there a need to suspend the classes? For school bus 19, usually there are 9 students with 2 workers. The 2 workers tested positive, and 2 students also tested positive. The 2 students came from different classes, but we're still monitoring situation to see if there are any other situations. There is no need for suspending classes yet. For the clinical guidelines, we're still discussing that. As I mentioned, now, we were talking about high-risk groups or different age groups. All these are under discussion, and if there's any update, we'll certainly announce it as soon as possible. I think you're referring to an 86-year-old male, right? He came to our designated clinic for treatment. At the time, his blood pressure and heartbeat were normal, and he had a mild upper respiratory tract infection. He was administered with oral medication, and then he was isolated at home and was under monitoring. And then 2 days ago, all of a sudden, he had a shortness of breath, so he went to the A&E, and then the X-ray showed some inflammation in the lung, and then his condition deteriorated further. At the same time, he had other underlying conditions. Thank you. Next, the one in green, please. And I'm from TVB. Now, again, there are confirmed cases with school buses. How can we avoid that? And for the Kowloon YN College, are there new cases? Well, no new cases with YN, but then, of people are in the same bus, of course, there could be transmission because Omicron is highly transmissible. But then we have RAT results every day, and then we'll be able to see if positive cases could be prevented from going into schools. And then we see if the positive cases form a cluster in a particular class or involving a particular activity, and then we'll see how we could prevent the disease from spreading further in the school. I'm from Ming Pao. First from Dr. Kwai Chung Hospital. Sorry, I didn't get the name of the ward. And is that what related to other wards with infection earlier? And for the 10 death cases, how many of the patients died with and how many died of COVID? And can you tell us again how many have had one jab, two jabs, or no jabs, and how many have had oral medication? Now, so how do you predict the trend? What preparations are you making for that? Now for Dr. Trong about school buses. For the infection control guidelines for school buses, would the requirements be less stringent? Is there a need to step up the requirements, say, in terms of ventilation? And the yellow code, now, maybe many cases are not reported to the government, so we may not know how many have been infected and how many are actually close contact. That's why it may not be effective to try to distinguish them with the yellow code. So there are other ways to estimate, or other indicators to estimate how many have not actually reported their positive results, so they could not be identified by the yellow code. Well, we know that there may be individuals who take a test, but they don't report their positive results. But we must appeal to them to report their positive results, because when they report the case, they will receive an isolation order. There will also be quarantine orders for their family members, and so the infected patient and family members won't be able to go to work and school. And if they report the cases, then the information could be sent to the hospital authority, and then the patient could receive treatment early. So it's in the benefit of the patient, him or herself, and family members as well. But of course, we know there are such people in the community. Many university studies have shown that if one person becomes infected, or maybe it's not the case that the person deliberately does not report a positive result, but rather the person is not taking a test and no symptoms, so he's not aware that he's been infected. And there are others who don't know how to report the cases, so they don't report their cases. But of course, we have appealed to people, if they encounter any difficulties trying to report their case online, they could call our hotline 1-833-6119 to report their cases, and our colleagues would help them with that. For school buses, there are general guidelines, and we not seeing a serious problem with school buses, because the infection could happen in any places. We just want to prevent positive cases from going into schools, causing a major outbreak. For Kwai Chung Hospital, you mentioned that's some continuous care ward. And we don't see any particular link with the other ward you mentioned. As for the source of infection, we're still trying to trace that, because there are many infection cases in the community. So we're trying to see if there are links among different cases. For the new death cases mentioned today, 3 were not vaccinated. 4 had 2 jabs. 3 had 1 jab. For the deceased patients, of course, when they were confirmed cases, then we would have given them oral medication. And then there's mention of this, of course, the exception is that there's a case of a patient who passed out at home, and he became unconscious by the time he got to the A&E ward, so he was not administered with any drug. Last question. We are now in the second phase. We are still monitoring the overall epidemic situation in terms of beds. We have a system in place. If there is a sudden surge in cases, then we would make adjustment to our manpower level and hospital beds. And of course, it's possible that for elective procedures, they may have to be cancelled. You say there's a double digit in the number of death cases today. Yes, we are very much worried about that, and that's why we have taken this opportunity today to appeal to the public to watch their condition closely, especially if you have elderly at home. They may not know that they are infected, so you have to watch the condition closely. And I mentioned the various channels we have, and so we'll be trying to disseminate information through various channels, and you could approach us through these channels.
啲死亡個案啦，其實係大部分都係
We saw that among most of the fatalities, most patients did not receive 3 shots, and less than 1% of the patients who pass away receive 3 doses. For elderly people in particular, we would recommend 3 shots, and among some of the fatalities, the patients did not receive any shots at all. Final question for the day. The lady on the back row to the right. This is commercial radio. In the last 2 days, the order of the announcements changed. You now would first share the number, patients in hospital before describing the overall daily figures. We were concerned that since most COVID patients were not in serious condition, and we believe the public might want to know more about the situation at the hospitals. This is the end of the press briefing.